Hello, everyone. Welcome to another episode of Chat with a Professional, the monthly oral health education series by Oral Health Africa Initiative. At Oral Health Africa Initiative, we're committed to improving oral health awareness, promoting preventive oral health care, and expanding oral health education across Africa. Through Chat with a Professional, we bring oral health professionals closer to the public through practical, relatable, and evidence-based conversation that empower people to make informed decisions about their oral health. Today, we are exploring a very, very interesting topic that deserves more attention than it gets: the role of oral health in maternal well-being, why oral health should be part of every pregnancy conversation. Joining us today is Nurse Queenet, a nurse with over 6 years of experience in dental nurse practice. She's passionate about oral education and she helps people achieve healthy teeth and confident smiles. She's also an entrepreneur and the founder of Queen's Store, balancing healthcare excellence with business leadership. Nurse Queenet, thank you so much for joining us today. It's a pleasure to have you.
Thank you so much for the invite. Thank you so much for bringing me here.
Thank you so much. We are so grateful to have you on the call. To begin with, what do you think is the correlation between oral health and maternal health? They look very far apart. Many people see pregnancy and oral health as two separate things. What exactly brings them together?
I would say that as a mother, before you get pregnant or even while you are pregnant, you yourself as a mother, you are supposed to be healthy before going on that journey or even while on that journey of pregnancy. Because if you as a mother, you are not healthy enough, then it's definitely going to affect the child in your womb. You as a mother, everything you need to do to be healthy, which includes your oral health, you need to do it so that when you are pregnant or along the line during the journey of pregnancy, the baby would not be affected. So there is a correlation because a healthy mother would be the one to carry a healthy child. If you are not healthy as a mother, it's definitely going to somehow affect the child.
Thank you so much for that. An healthy mother can only give birth to an healthy child. If you're not healthy as a mother, there are chances that the child that is going to be giving birth to is not also going to be healthy. And being healthy also includes oral health, right? Yes. Thank you so much for that. We have a lot of things that people say around these days, especially in the African setting. There are a lot of myths and beliefs that surround pregnancy and dental care. We hear things like, it is possible for a woman to lose a tooth with every pregnancy. Some will say, during pregnancy you are not supposed to carry out some procedures like scaling and polishing. Like a lot of things people say. Some will say, you are supposed to, you would have bleeding gums. So we want to know, are these things really myths or they are things that really, really happens in pregnancy?
When you are pregnant as a woman, your hormones become high, your hormones become irregular. And these hormones also affect your oral cavity. These hormones can allow your gums swell up, which we call gingivitis, swollen gums. Then when these gums are swollen, the gums begin to bleed. And if you don't take care of that swollen gum by maybe going to the clinic to do scaling and polishing, brushing regularly, the gums become inflamed and then becomes infected. Now, when these gums become inflamed, that's swollen and infected, it starts affecting the tooth itself. The gums and other supporting tissues hold the teeth in place. When these gums are infected, are swollen, they begin to affect other supporting tissues, and then that is when that individual can lose their teeth or their tooth, depending. As a mother, it is very, very important. As a woman, it is very, very important for you to take care of your oral cavity very, very well, especially during pregnancy. Because when you don't do this, you can come down with bleeding gums, which is just a slight reaction of your hormones. Your hormones make your gums swollen, but it doesn't mean you should actually lose your teeth. It doesn't also mean you should actually start bleeding. But when you don't treat that is when you start having bleeding gums, you start having loss of teeth, because they are called gingivitis, periodontitis. It's just very, very important that as a woman during pregnancy, you shouldn't neglect your oral care, because you are just pregnant. So people will tell you they are not supposed to go to the dental clinic because they are pregnant. The pregnancy nothing concerning the stomach with the mouth, which is wrong. They'll be like, maybe it's my stomach that the child is in. It's not my mouth. If your mouth is affected, it's definitely going to affect the child because you will not be able to chew properly. Imagine a woman that has bleeding gums, swollen gums, her gums are inflamed. She will not be able to chew. And how will she be able to eat if she cannot chew? At the end of the day, the child will come down with poor nutrition because the mother is not taking enough diet or the right diet is definitely going to affect the fetus. It's very important that a woman should eat properly, should take care of their oral cavity so that it won't affect other things while pregnancy.
Thank you so much for setting that context. Thank you so much. And it's true that pregnancy brings a lot of significant hormonal and physiological changes from what you've explained to us. Which of these changes are normal? So that we can know, okay, this one is normal, this one needs immediate dental attention.
Well, these things are normal, but they should be controlled. They should be. You cannot actually just neglect it because that mother or that woman might not really know so much and might not really know how bad or how worst that condition has gone. You should actually check it. It's just like when you are bleeding. Let's say you have a cut on your finger and then you sit down at home and don't do anything to it. You just clean it and just overlook it. That cut is normal for it to bleed, right? Because yes, there is a opening there. But the right thing to do is actually to go to the hospital and check if that cut will need suturing or extra care. But if you sit down at home and just clean it, it can get worse. It can get infected. It is normal because of your hormones, because of the hormones in a woman's body. And you know, no two pregnancies is the same. You can be pregnant now and it will not affect. Your hormones might not get that irregular. And you can be pregnant tomorrow again and everything is just happening. It's not like as if these things are... It's not like as if it's supposed to be like that for everybody. And it's not like as if these things are not normal, but they should be controlled, they should be checked, they should be monitored. You should actually, the moment you see that, your gums are swollen now, inflamed, you are supposed to go to the dental clinic and make a complaint. Because swollen gums too can be a sign for some other things. You really can't say, okay, person had pregnancy and she has swollen gums. Oh, that's how it is to be. Let me just ignore it and just say it's normal. It can also be a sign for other things. You need to go to the hospital to find out that yours is not because of any other thing. It's because of you are pregnant and everything is okay. You can go home. And sometimes they might need to do scaling and polishing for such an individual. Then some women usually have morning sickness whereby they keep vomiting and vomiting.
Exactly.
While they are vomiting, it tends to affect the enamels of the teeth because when we eat, we bring out acid back. By the time it comes back out, it's going to be acidic. And this acid begins to affect the enamels of the teeth and it begins to cause erosion. The more a pregnant woman keeps vomiting, it's affecting that tooth. And that tooth or that teeth becomes susceptible to caries. That's why you see some women, they come down with caries, and then because of the way pregnant cravings happen,
pregnancy cravings, chocolate today, ice cream tomorrow,
sticky things, pregnant women tend to come down with caries because they end up eating these things. Sometimes they even eat at night and they just go to bed like that. This sticky food just remain there, and you know what will happen now. Caries formation begins. You need to make sure that you are always coming to the dental clinic because you don't know how far these things would have caused harm to your body. They are normal, but they should be controlled. They are normal,
but they should be controlled. Thank you so much for that. And as a matter of fact, you've even answered my next question, which is the concern with morning sickness, right? A number of women experience like morning sickness, and which causes them to like vomit from time to time. And of course, after vomiting, someone to like brush their mouth immediately to clear off the dirt of the vomit immediately. And a number of times the enamel begins to wear off and all of that. Instead of brushing frequently, what should they do instead? What's the advisable thing to do?
First of all, I would say when they vomit, they should rinse out. You know how when we eat, food particles stays in our mouth in different corners, and then the bacteria in our mouth feed on it and produce acid. It's the same way to when they vomit what they've eaten and they don't rinse out. Those food particles too, will remain in different angles of our mouth. So when they vomit, they should always get the clean water, rinse out, gargle well, and just rinse out. Then they can also just wait a while, like maybe 30 minutes before brushing, because you don't want that effect to affect the enamel of the teeth and cause erosion. That's it.
Thank you so much for that. So yes, so very quickly we'll look at the next part of this conversation. Let's talk about, we hear that a lot of women avoid dental clinics once they become pregnant, and I feel like, have you had such experience in your years of practice?
Or women not coming to the dental clinic?
Yes, or pregnant women not come to the dental clinic.
Yes, they believe that there's nothing wrong with them. Normally, a lot of people even believe nothing is wrong with them until they feel pain.
Yes.
So when they are now pregnant, especially for when the mother is going through a lot in that pregnancy journey, such a mother will not even be interested in dental, because she's already maybe tired, in pain. The last thing that will be coming to her own head is to be coming to dental clinic, because she might even be feeling already that coming to the dental clinic is even pain. It's painful. Anything they want to do for me in dental clinic is painful. We have a lot of mothers that don't think they should actually come to the dental clinic when they are pregnant. Yes, I've
experienced such. Okay, so what would you say to them using this episode of Chat with a Professional as an avenue? Is pregnancy a good time to visit the dentist? What trimester is considered the safest for dental treatment, and what dental treatment are considered safe for pregnancy, basically? Or there's some that didn't like respond that this one you can't do it in pregnancy, you have to do it later.
First of all, pregnancy should not stop your regular 6 months visits to the dental clinic. Your every 6 months visit, it shouldn't stop it. Yes, it will even help. It will help the mother, the woman, very well if they come for their regular 6 month appointment. Because if you're coming for your regular 6 month appointment and you're pregnant, yes, there are some treatments that they might not be able to do at maybe the 3rd trimester. If you come on time, you would have already noticed it, prevent it, or cure it at an early stage, instead of it getting to that point where they will have to take an x-ray. Mostly it's because of the x-ray. Mostly it's because you don't want to induce labor. That's why we postpone some of the dental treatments. Now, you see, it's very helpful when you come every 6 months. It will actually help the mother from going through so much stress, spending more, and doing more invasive procedure. Now, when you're pregnant, ensure that you inform your dentist and your nurse when you come to the dental clinic. Let them know, oh, I am pregnant. I am 2 months pregnant. That whatsoever procedure they might want to do for such a woman, they would know if they should either postpone it or do it at that moment, or not even do it at all. Look for an alternative. And some people are pregnant, they are aware that they are pregnant, and they will just go to the dental clinic and just eat it from their dentist. They say you cannot lie. 3 people you shouldn't lie to: your lawyer, your doctor, and your pastor. You shouldn't lie. You shouldn't hide such information from your dentist. Now, there are some basic procedure like scaling and polishing. For scaling and polishing, that is not a very, very serious, let's say the patient has been keeping to an appointment, 6 month appointment, or at least once in a year appointment, then I'm not expecting such a person to have heavy calculus. If it is just a basic scaling and polishing, that can be done at any of the trimester. Yes, but any invasive procedure, especially procedures that would involve taking an x-ray, because we don't want to expose the baby to rays. So we usually provide protective jackets for the mother, but we still don't want to leave it to chances. So we usually try to maybe postpone such procedure. If you don't tell your dentist and your nurse that you are pregnant, they might just go ahead to just take an x-ray and just proceed with it, especially when it's not even obvious that you are pregnant yet. Procedures that are invasive, procedures that will take longer time, they are usually postponed, especially when the mother is already at the 3rd trimester, because we don't want to put the mother into stress. We don't want to also induce labor. The safest period is usually 2nd trimester, but it all still boils down to the particular procedure that they are going to be doing for that. woman, because we have a lot of invasive procedures. We have major surgeries that we do in dental clinics. So the key point here is that, one, as a pregnant woman, you should not neglect your twice in a year regular visit to the dentist. It will help you to protect your oral cavity, and then preserve you from going through a longer procedure. Then two, ensure that you always inform your dentist that you are pregnant when you are pregnant, so that they would know the particular treatment that is suitable for you, and not just treatment, even medication, because there are some medications that are not advisable to be taken during pregnancy. For example, is flagyl. If you take your flagyl as a pregnant woman, it's at that moment the teeth of the baby is developing. It can affect the color of the teeth. Very important that you inform your medical practitioner, dentist, and the nurse that, oh, I am pregnant during the journey.
You've said so much, and the key takeaway here is that, one, do not hide your pregnancy from your healthcare providers, be it the doctor, a nurse, a dentist. Do not hide your pregnancy from them, and in that case, once they are informed, they can tell you which procedures are safe during pregnancy and which would have to be postponed until after pregnancy. Thank you so much for that. So we are wrapping up. Does the responsibility of oral health care in maternal health ends during pregnancy, or it still extends up until after childbirth?
Well, like I said earlier on, you as a mother or as a woman, you are supposed to be healthy. So if you have that in your mind, that I am an individual and I am supposed to be healthy, my oral health is supposed to be good, then you would know that whether I'm pregnant, whether I'm not pregnant, then these things cannot stop. It continues. Be it during pregnancy, be it after pregnancy, it continues. And to kind of answer your question, yes, it doesn't stop. It doesn't stop at pregnancy, because when you put to bed, you are supposed to still bring your child to the dental clinic. Some child are born and they have tongue tie. So you are supposed to bring your child, you and your child, you come to the dental clinic to visit the dentist. But some mothers will be like, my child now sits now. Why bring the baby that I just born? What am I bringing the baby to the dental clinic for? But some children are born with deformity. Example, cleft lip, the cleft palate. So they are born with deformity. They are born with tongue tie. It is the right thing to do by bringing your child, your baby, to the dental clinic for examination, because early detection really matters most. So when you notice that this child has deformity, you can start planning for the surgery or for what next to be done. It is very important as a mother that they come even after childbirth, because even after childbirth, let's say we've been treating such mother let's say we've been trying to fix that mother's teeth and we couldn't proceed and finish the procedure. Let's say, for example, we are doing RCT for the mother and we couldn't finish the procedure because of the stage of the pregnancy. You will not say, I put to bed, forget about that.
I'm going to continue.
You have to come back and finish up your procedure. All that was supposed to be done that we couldn't do when you were pregnant, then we need to finish it up. So it doesn't end here. Every individual needs to be whole, needs to be healthy, whether during pregnancy, before pregnancy, or after pregnancy.
Every individual needs to be whole, whether during pregnancy, before pregnancy, or after pregnancy. Thank you so much for that. And you sound so much like an activist. And I would ask you one question now. If you had an opportunity to improve maternal health care in Nigeria, what change would you ensure to make sure that oral health becomes part of the routine maternal care?
Well, I'll make it compulsory. In the sense that every mother will know that before they can go ahead with their delivery in the hospital, then they need to have been cleared by their dentist. Part of the package. You know how when you go to maybe primary health care center, we have the package, we have the list of what you buy for the baby, we have the list of the vaccine you need to take as a mother. They give them this orientation of what to do now that they are pregnant, the medication to start taking, the things to buy for the baby, the tests they need to do. But we don't really hear the visits they need to visit to the dental clinic. They don't put it in package. So they need to actually put this thing into package, because there is no how. If a man is not doing this vaccine, is not taking this vaccine, I don't think you really go ahead with that delivery. you will warn the woman that this thing you are doing is not healthy for you. If the woman do not do the test that she's supposed to do, you will not go ahead. If she does not, I don't know if you've seen any woman that registered in the hospital and did not do scan. It's coming to that hospital and you want to take the delivery. I know some quacks will do it all, but it's not the right thing to do. No professional will actually accept to take delivery of a child that they have never done scan for, because it's included into the package. They've made it mandatory. They've made them see the reason why they should do it, how important it is. But dentistry, dental care is not included into the package. It's not mandatory, so nobody cares. It's only some people that knows this thing that's actually do it, or some people the only reason why they went is because they found themselves having pain. If I had the power to make a change, then I will include it into the package, let them see the reason why they should actually do it, and then I'm sure there'll be a better turnout.
Thank you so much for that. It's been an interesting conversation so far. Thank you so much. So one final question: what's your final word for any pregnant woman that watches the video?
If you're pregnant, then you should actually visit the dental clinic. Visit your dentist. Your pregnancy shouldn't stop your regular visitation to the dental clinic. Do not see it, when I visit the dental clinic, then I'm just going to feel pain. See it as the right thing you should do, whether you are pregnant or not. And even when you put to bed as a pregnant woman, do not wait till your child have pain before you bring them to register in the dental clinic. Always bring your baby for examinations even after you've put to bed, so that everything that needs to be prevented can be prevented.
And how about their routine oral health practices like brushing?
Oh yes, that should not be neglected also. Make sure that you rinse out if you're having morning sickness. Make sure that you always rinse out whenever you throw up. Make sure that you eat healthy during this period, because your baby will take a lot from you. So make sure that you eat healthy. Make sure that you also brush regularly, because that is very, very important. The mouth is the gateway to the body. Whatever happens to your mouth will affect your general health. So ensure that you brush regularly. Then ensure that you pass that same practices to your children when you give birth. Thank you.
The mouth is the gateway to the body. We've heard so much today. Thank you so much, Nurse Queenet.
Thank you.
Knowledge, for sharing your experience with us. Today's discussion has reminded us that maternity is not complete without oral health, and pregnancy is another valuable opportunity, not just to care for the oral health of the mother, but to lay a very good foundation for the oral health of our child as well. And to everyone watching, we encourage you to make oral health a part of your routine. During every pregnancy conversation, speak to your dentist, ask questions during your antenatal visit, and don't ignore any changes in the mouth, because a sign in your mouth can be a sign of something huge happening in your body. Thank you for joining us on another episode of Chat with a Professional by Oral Health Africa Initiative. And until next time, keep smiling and keep prioritizing your oral health. Thank you.